ladies and gentlemen, this is Taylor here, and you know I've done the Operate Now video, right? Well, there's another surgery simulation series called Surgery Squad, but none of those games work anymore. However, they have a whole YouTube channel with all, like, most of their procedure simulations, so we're gonna react to those videos. Alright, let's get right into it. Alright, the first one is LASIK Eye Surgery. Here we go. Surgery Squad! Yay! Alright, there we go.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll
Hello,
be guiding
Dr.
you
Susie.
through a LASIK eye procedure today. LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam.
Time out. Have you guys ever watched Final Destination 5? Spoiler alert, there's this lady named Olivia Castle. She went to the eye doctor to get her LASIK eye surgery done, but things went so wrong. It just went right through her eye and her eyelid and her hand. And then when she stood up, she tripped on something and fell. It fell to her death right on top of a car, and the eye the laser burnt, popped out. That super gross. Also, in the first four Final Destination movies, there were boobies.
Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
Alright. It's not even doing it for me, it's just whoever's playing it.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean.
There we go.
Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
It's also used to hold your vagina open.
So let's get that speculum over the eye.
Alright, let's open that eye
If the
open
patient was
wide.
allowed to blink, we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye.
Oh, there we go. Now let's pick that
The ring
suction
sucks
ring.
the cornea upward, making it easier to cut. The patient's vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
Alright, there you go, doctor. Alright, here we go. Ew, 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 ew! Oh, that's gross.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea. This is the part we'll reshape with a laser. The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove.
I just had a bacon
flip of
salad.
the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds.
Whoa.
The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair. And
How
that's
does it
it.
not burn through
Please
the
fold the
eye?
corneal flap back into the original position, making sure our ink guides match up.
Ew. Ew.
Nicely done. While you were working, I went ahead and took care of the other eye. We will
How dare
observe our
you!
patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will
Sure
be bonded
is.
back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on SurgerySquad.com.
Okay. That's actually pretty cool, but also gross at the same time. But you still got 2 more to watch in this video.
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure.
My name is Jeff.
Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine.
No!
There are
Oh my gosh. You're basically cutting like most of your stomach off and making a new stomach out of oh my gosh. I don't ever want to go through this. Like my goal is to drop some weight before Halloween. So I look nice in my costume. I'm planning on being more Calliope this year. And so far I'm making pretty good progress.
several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes. Our patient has been prepared for the procedure with a mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland. From here, we'll place an
Dreamland!
endotracheal tube down the patient's throat. You're up. See if you can get the tube into place.
Oh yeah, I forgot.
Great work. This tube is then connected to a
Oh!
respirator.
Ew!
The patient is ready to go. Now we can begin our laparoscopic procedure.
They're like shoving like a tube down your throat. Like if I ever get intubated while I'm awake, I would just be like, "Ugh, ugh, ugh," and I throw up all over the place.
The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide
Wait. Do we need to put iodine on the belly before that? Obviously, we need iodine before every procedure.
the scalpel in where I have marked to make the incisions. Be careful, these are small incisions. Don't get carried away.
Alright. Ooh. Oh my gosh. Well, and it's got bruising too. Whoa. Bada bing. Bada boom. And bada boom.
Nice technique. You must have an excellent teacher. Oh wait, that's me. Next,
Okay, I'm not squeamish, but the thought of like getting like surgery on my belly is just super scary. And I'm just crossing my fingers that my appendix doesn't burst anytime soon. Because what if they have to, like, there's such a thing as a laparoscopic appendectomy, or they make these small incisions right here, and they put like those tricky pieces thingies in there, and they put like cameras in there and laparoscopic tools, take the appendix out. But what if they have to slice you open? What if they have to slice me open for that? That's so scary. Oh my gosh. Like, okay.
We'll place a device called a trocar into each incision.
Those are turkey basters, Jeff. Those are turkey basters. This is surgery squad, not kitchen squad.
These devices allow us to easily slide the instruments into the
By
abdomen.
the way, they have a turkey
Some of the
cooking
instruments
simulation.
we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the stapler.
There we go.
Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide. Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg.
No,
We do this by first placing
I'll only be able to eat one egg for every meal for the rest of my life. That's not good. Hopefully I won't ever have to go through this crap.
a line of staples that separate the smaller new stomach from the
Staples!
whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch.
Whoa, 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 whoa. Whoa, whoa, whoa,
We'll now
whoa.
separate the small intestine from the old stomach, about 2 feet down.
Oh no.
The lower part of the intestine will be connected to the new, smaller stomach with a ½ inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a ½ inch opening where indicated in the new stomach
Rerouting
pouch.
traffic. Whoa.
Now, drag the loose end of the intestine to the new stomach pouch to attach it. I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated.
Alright.
Again, I'll suture
This
it all
actually
into
gross.
place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars.
Let's take out those turkey basters.
Now we need to suture each of the incisions.
Alright. A suture for you, a suture for you, a suture for you, a suture for you. Is Dr. Strange doing this? Do we have like a super Dr.
Nice
Otter?
work. I bet that
here?
won't even leave a scar. Now our patient goes off to recover. In most cases, they'll
Generic hospital? Oh my gosh. Alright, here we go.
spend a few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits.
Check out our other videos on surgerysquad.com.
Oh. That's new.
Welcome to Surgery Squad's virtual laparoscopic appendectomy. I'm Dr. Jeff, and I'll be assisting you with the surgery
it's
today.
a different voice.
An appendectomy is needed when there is a blockage between a patient's appendix and intestine. The blockage develops over time and may cause occasional pain. However, left untreated, the patient's appendix could burst, causing severe internal infection and potentially death. Today we'll be using a minimally invasive technique called laparoscopy to remove our patient's appendix. Laparoscopy reduces the exposure of internal organs to contaminants, shortens recovery time, and results in less post-operative scarring. Our patient is a female in her 20s that has been experiencing severe pain in her mid-abdomen, vomiting, and a mild fever. These are all common symptoms of appendicitis. Let's scrub in before this gets any worse.
Alright, let's go.
Our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal, or breathing tube, in the patient's mouth and into her throat to help her breathe during the operation.
This is going to be gross.
Since I've already taken care of inserting a catheter into her bladder, we can move on to more
A
important
catheter?
Thanks to the advancements in medical technology, our patient doesn't have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery. We'll begin by making one small incision in her upper abdomen, one in her lower abdomen, and one in her navel, also known as the belly button.
Oh. Oh wait, the scalp is bloody, so it's a lot messier than last time.
You handled that like a pro. Now
I
we
didn't.
need to pump carbon dioxide gas into the patient's
I'm
abdomen
on standby.
to obtain a better look at the surgical area.
Alright. Place that CO2. Do
Next,
that turkey
we need to
baster.
insert our laparoscopic camera through the umbilical trocar. Images from the camera are projected on our monitor to allow us to inspect our patient's abdomen and confirm that the appendix is infected.
Alright, let's put that magic wand in there.
The inflamed and swollen area you see is the patient's appendix. Our next step is to remove it before it becomes an even greater problem for our patient. The appendicular artery needs to be sealed using a diathermic instrument which uses extreme heat to cauterize the artery.
Wait.
The artery is then divided using scissors. So far, so good. Keep it up. The appendix now needs to be lassoed with a detachable snare. Take the detachable snare and slide it over the appendix all the way to the base.
It's going to be hung on the
2 more
streets.
times, placing 2 more loops above the first one.
Of making people sick. Ooh. Oh! Oh man. Wow. Wow.
Almost there. Now we need to remove the appendix. Use the scissors to snip between the loops. Notice that when you snip, a little pus comes out, indicating that the appendix is infected. Don't worry about it though, we'll clean up everything. To remove the appendix from the abdomen, place it into this specimen bag and pull it out through the trocar.
Specimen bag? There's a bug in your appendix.
Now on to the cleanup. We've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean. With a flick of a switch, our saline is suctioned back into the same device. Finally, we'll remove the trocars and close the incisions with a few surgical staples.
Don't we have to close up the incision on the, where the appendix is?
Excellent work.
Also, kids staples.
The length of the inpatient care and the
Karen became a man. Karen is now a man. You can call him Ken. Actually, he looks like Alex Jones.
recovery process following an appendectomy usually varies based on the severity of the appendicitis and the person's age. Luckily, our patient is relatively young and healthy, and we caught her condition early. She should be clear to go home within a day if there are no complications. After being released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster, but she will need to walk short distances several times a day to speed up the recovery process. She should make a full recovery from her appendectomy within 4 to 6 weeks since her appendix did not rupture. Had it ruptured, a full recovery may have taken up to 8 weeks. And that's an appendectomy. You did amazing! Why not try your surgical skills in another surgery here on SurgerySquad.com?
Check out our other videos on SurgerySquad.com.
Wow. It's amazing that... Oh, shut up. It's just amazing that throughout those thousands of years of scientific discovery and endeavor, that they're able to do this. They, instead of slicing you open, they make tiny incisions in your belly to remove your appendix. That's pretty cool. And it's also safer. Like shoving turkey basters in those incisions and putting cameras and laparoscopic instruments in there, taking out your appendix and whatnot. Wow. These things are actually pretty cool, but they're gross at the same time. Alright, that's it guys. Don't forget to subscribe to my YouTube channel, and I'll do part 2 of my reaction to Surgery Squad simulation videos. Bye!